Everybody, and it's almost hard to believe it's 6 months. Where the time fly. I knew it's a new world out there in 2020, and it's been crazy for all us to adapt to. Unfortunately, the COVID-19 is not done with us, and we're hoping, I think Liza and I are both hoping, that we don't get a second wave and people continue to do the right thing. But since the last time I reported, September, or the 4th of September, we had 13, then the next day 3, the day after that 3, the day after that 4, then 11, 8, and 12, so total 40 new positive cases since then. But as of today, there's 2,604 positive cases of the coronavirus in Albany County. 341 people under mandatory quarantine. That's an increase of 12 new positive cases since yesterday. We had 8 new positives yesterday. Among the new positives, 6 have close contact to positive cases, and 6 didn't have a clear source of infection at this time. 10,287 people have now completed quarantine, and of those, 2,546 tested positive for the virus and have recovered. That's an increase of 8 recoveries. There are now 14 people hospitalized. I told everyone that's the thing that we talk about in the control rooms. That's the number that they watch: hospitalization, ICU, beds available if we get another outbreak like we did 6 months ago. We were up to 15 at one point in time, but we're at 14. But the hospitalization rate is 0.5% of those tested positive, and we still have 1 patient currently in the ICU. That number stays the same at 1 since yesterday. Over the last 5 days, there has been an average of 7.6 new positive cases each day, and before that it was 5.8 the average. Again, we continue to tell people, if you have any signs or symptoms, or you don't, please, if you have any, you should go get tested. Go to the testing sites. It's free at UAlbany through our mobile testing sites. If you don't have insurance, we pay for it. And Rite Aid and Colony and Walgreens on Holland Ave are both free. So there's options out there for you, but please continue to do the right thing, coughing into your arm, wearing your mask, and continue to socially distance, and we'll continue to get through this. You can call UAlbany at 1-888-364-3065. Our mobile testing site, as always, in partnership with Whitman Young, area code 518-465-4771. The Rite Aid side, you got to go online, as always, to riteaid.com. And the Walgreens is walgreens.com/findcare/COVID-19/testing. Priority 1 in Gilliland for the antibody testing, area code 518-867-8040. Again, please go out and get tested, do the right thing, and we'll get through this. Got to sneeze in your arm, walk away. It's working. Our numbers go up, they go down. Obviously, after this weekend, we'll be watching numbers even more. Hopefully, people did the right thing. The colleges have all have great protocols in place. Obviously, they made example out of some of the students at UAlbany to stop the congregate parties going on. So the message is out there, and people are calling us and taking pictures. It's great. People are trying to do the right thing, and again, we'll continue to get through this by doing the right thing. And we all were hoping we wouldn't be here 6 months later. But I couldn't ask for a better partner than Dr. Whalen and her team at the Department of Health, and being by you for these last 6 months. Probably more phone calls than we wanted to take with each other, and we have our disagreements like everyone else. But it has been a pleasure working with Liza and her team, and unfortunately now people in Albany County know why we have a Department of Health and what their function is, because when things are good, we don't hear from you. When things are not good, unfortunately, this is the role you play, and you step up. And again, I can't thank you enough. But Dr. Whalen.
Thank you. Thank you very much for that, and I would also like to thank the team that I have at the health department. We have a staff that is very dedicated and has been working really 24/7 for the past 6 months, including working on weekends to ensure that we are investigating every single case, to make sure we're responding to concerns and complaints, to working with our community partners. In particular, I'd like to thank Mary Beth Miller, Assistant Commissioner, who has been by my side in the health department and helped me on a daily basis get through this. We're very lucky with the team we have. Our Department of Nursing, headed by Kathy DeThomas, who's here, our epidemiologist Liz Lewis, and many others, which I look forward to recognizing more at a future date, because they've just all done a phenomenal job. So one of the things that we are getting questions about is when we talk about the number of cases that we have, there's always a category of people that we don't have a clear explanation of how they contracted COVID. People sometimes identify themselves as being a close contact. So we know if they were a close contact or a household contact to somebody that has previously been diagnosed, this is an easy answer to how they contracted COVID. But often we hear that people are not aware of how they may have contracted COVID. And there's usually, this is 2 scenarios. The first scenario is that we just don't get an answer. They look back, they start to ask friends, they start to trace what they've done, and they just don't know how they could have contracted it. So this, we can hypothesize why this could happen. It may be because they were in contact with an individual who was asymptomatic, and we know that asymptomatic spread of COVID can occur. It may be because they were in an area where they touched a surface and then touched their face. These are the reasons that the guidance is in place. And the second reason is that sometimes they say on the first interview they don't know, but then when they start to ask a broader group of people, they find out they were in fact in contact with someone, or someone else that they know gets diagnosed around the same time. What's the message from this? The message from this is a message that we started talking about very early on in this outbreak, and that is that you should act as if you already have it. You have to really protect yourself, because you could have COVID and be asymptomatic and spread, or you could come into contact with someone who's asymptomatic. So the guidance around social distancing to people that are not in your immediate home, to wearing masks when you're out and about, and practicing strict hand hygiene and social distancing are really the best measures of protection that we can currently offer. So we continue to advise people to follow that very important advice. It's particularly important to our college-age students. We've already seen around the country examples of colleges that have had to be closed due to high numbers. We've started to see small numbers of cases in the colleges and universities in the county, and we're monitoring that very carefully. But that age group is a challenge. Because there is a perception that they may not get seriously ill if they got COVID. We cannot guarantee that. If you get COVID, if you are young and healthy, you can still get very sick. If you get COVID and you are not sick, you can still transmit it to someone who may end up dying. And none of us want that to happen. So it's not hypothetical. This is reality, and this is the reality that we live in. So the advice that we continue to give the college students is what we tell everybody else, but it's most important for those that are congregating in these kind of party environments. It just can't happen now. And I know I've mentioned this before, I have 2 college-age children myself and a child in high school. It's difficult. I understand that. I understand that kids want to be around their friends. They want to enjoy all the usual benefits of a college social life, but we just have to continue to do what we're doing for the time being, because otherwise your college may end up being closed and nobody wants to go back to their high school bedroom. So I would continue to advocate for that. And I also want to, again, bring up the importance of a flu shot. We mentioned this at our last press conference, and I probably will continue to mention this. Flu shots are available now at many providers' offices. They are available in many pharmacies in the area. We are starting to get a shipment in, but at this point we don't have enough in the health department to make appointments, but will by the end of the month. So please get your flu shot. It is not too early to get a flu shot. Once you get a flu shot, it takes about 2 weeks to take effect. So it's better to get it early, and it will help prevent from getting the flu. And if you end up getting the flu, despite getting a flu shot, it will make your flu milder. It is evidence-based. It is something that, we really need to stress the importance of, and we will continue to work with our providers and all our community partners to ensure that we get that message out. Thanks.
Thank you, and I appreciate that. And I just always wonder what the argument in your house is: who's the better doctor, you or your husband? And I gotta say you. I'm gonna pick you over.
Oh, that argument never happens.
I just gotta, it's a unique situation that you're in. And but thank you to both of you for what you do in the community.
Thank you.
And everything that happens at the health department. So again, Dr. Whalen, thank you for everything that's going on. Just to highlight a few other things before we close. Our Department of Probation's doing a great job. We started a lot of new initiatives, Just to Success, DMV, getting your 5-hour certification, Project Growth. And people talk about, why do you do this? Well, it gives kids and adults a different option. It gives them the right path to look at things differently, give them hope at the end of the tunnel. So to the probation department, again, for some of the stuff that you're doing, but we provided online courses that help probationaries to stay current with all their fiscal obligations and strategies how to create and manage a budget, which is huge. So again, to everyone down at probation for continuing to think outside the box and doing neat stuff, thank you so much in these difficult times. When we talk about, for the last 6 months, and we go back and forth, and we talk about COVID-19, and we talk about the economy now and everything else that we're dealing with, there's another crisis going on, too, besides that, and it's the census. And people don't realize that if we don't fill out that census card, and we're in trouble. You have over $1 trillion that are at stake, and what's it mean to us here? It means less representatives in the House, less Congress people. Some people might like that, but that's less people fighting for New Yorkers to get our money that we're entitled to. And if we don't have our population up there, it means less money for transportation projects, schools. And if you see what's going on with this 20% reduction in school districts right now, it's going to set us back. And you look at areas where people need the most help right now, and it's one of the things we have always identified through the COVID-19 and through global and the stuff we're having with the crude oil and the tractor trailers in these neighborhoods. Well, again, in these tough times, this is when we need to step up, and we need to roll up our sleeves, and we need to work with the community. But the only way we can do that is if you fill out the census. They tried to end it. The decision made it to the 17th of September. They're trying to get it pushed back to October, but people are still out there knocking on doors. And then the average rate now is like 68%. We need more people. That's a national average. We need more people to fill it out. We really do. So we got a $150,000 grant from the state of New York to advertise, to get things out there, and to partner with people, and we partnered with the YMCA, Boys and Girls Club, United Way, as always, has stepped up to the plate, other variety of organizations to get the message out there, and we've given money to the towns, cities, and villages to do the same thing. We need you to take the time to fill it out. If you see how we're struggling now for stimulus package 5 to help us bail us out through this COVID-19, things are only going to get tougher. And again, I don't want to scare people. I don't want people on Facebook or social media saying, there I am, fear-mongering. I'm not. I'm just giving you the reality of why we need these dollars and why it makes so much sense. And the same thing, we can't do this without you, and that's why in partnerships like with the YMCA and other people, it really helps. But if you look at our 2010 census, we responded with 68%, 68.7. As of right now, we're only currently at 65, so I apologize, 65%. So we're down from 10 years ago. We should be higher than that when people are home to fill this out. So please take the time and fill it out. Menands is nearly at 66%. Watervliet's at 58.2, Cohoes is at 55, and Albany's currently at 53. You can go to www.census2020.gov, and it takes less than 3 minutes. You know, when you're home all this time, socially isolating and doing the right thing, you should have been filling this out, because trust me, when it comes down to dollars, and we're all going to be fighting next year for money in trying to continue to run these great programs that we run, or the programs like our Department of Health that does so much in the community, we need your help. So please take the time. As always, our mental health support is available 7 days a week from 8 a.m. to 8 p.m. and in our 24-hour sexual assault hotline number at 518-447-7716. Our 211, as always, with United Way, and in New York State hotline.